Hello, good afternoon, good evening, or good morning from Geneva, headquarters of the World Health Organization. Every Wednesday with you are our Dr. Mike Ryan and Dr. Maria Van Kerkhove answering your questions about COVID-19. My name is Alexandra Kuzmanovic from the Department of Communications, and I would invite all our viewers watching us on Twitter to use the hashtag AskWHO while asking questions. If you're watching us on Facebook, YouTube, or LinkedIn, please leave your comments, questions via comment section. Good afternoon, Maria, Mike, how are you?
Hi, Alex.
Thank you for finding the time this week again to answer the questions from our viewers, especially as we are marking this painful moment this week where we passed 1 million lives lost directly to COVID-19 and millions others suffering either being affected by the virus or for other health services being disrupted. However, how do you see the way forward and how we can improve things?
Well, Alex, thanks for having us again. And I think indeed we're at a really tragic milestone right now of at least 1 million deaths due to COVID-19. And these are deaths that have occurred over the last 9 months. From a new virus that has entered the human population, spread across the globe. And I think we need to take some pause and actually reflect on this. It's not just a number. These are 1 million lives lost. These are
about that, and what can we do, and what is possible, and it is the art of the possible now for us. But it is difficult, as I think we'll maybe just speak about this later. I think people are generally finding it very hard to sustain the effort to maintain and sustain all of this effort in terms of trying to avoid infection and trying to do the right thing. So I think that's a moment of reflection for us all, is to recommit ourselves to fighting this virus and in honor of those who have died, but also to protect those who may die in the coming months.
Thank you both. Maybe this is a moment as well to reflect on what we have learned in past 9 months, while we lost some people, unfortunately, but also while we treated many people and while we also prevented many people from getting sick.
Yeah, I mean, in the last 9 months in terms of our advancement in science and our understanding of this virus is pretty remarkable, in the sense that the entire global community has come together to better understand what this virus is, how it transmits, the disease and diseases that it causes in people, and what we can do to prevent the virus from spreading, what we can do to prevent people from getting infected, from developing severe disease and from dying. And so this collective drive across academics, public health professionals, frontline workers, people in different ministries and different countries all over the world have really come together to push the boundaries of what can be done in a 24-hour day. There are so many people that have been working, incredible hours, because we all have a common goal, is to understand this and to end it. But in terms of advancements on, we know that there are things that can break chains of transmission. We know how the virus spreads between people, and the steps that are necessary to protect people. The advancements on clinical care, making sure that people are detected earlier, that they enter the clinical care pathway, they are triaged, assessed and triaged, making sure that there's a clinical assessment to know what is needed for this patient. Early access to oxygen, early access, to symptomatic care, and for severe patients and critical patients, having dexamethasone. I mean, all of these actions save lives. And so it's that knowledge that has been used to make guidance. It's that knowledge that has been used to create trainings. It's that knowledge that has been used to say what is the right personal protective equipment that needs to be purchased and procured and shipped. And it's WHO and our partners who have helped us to realize the use of science. Having science in a paper, having science on a piece of paper is one thing, but really what we try to do with our partners is to turn the science into action. because that's what saves lives. So there's been a tremendous amount that's been learned in the last 9 months, and we continue to learn. So it doesn't end. You know, the science doesn't finish, and there's a lot of research questions that have been identified and prioritized, but those research questions will be answered, and then more questions will come up. So we continue to work, and that's the process that is science.
Yeah, I think, and I really second what Maria said, and I think while we may be all frustrated and all of us want to know more, in the past it's taken decades, years, months at the very least, to have even a basic understanding of some diseases that have affected us. It took us years to understand HIV and AIDS. It took us years to work out what was causing AIDS. It took us decades to work out what the hell was going on with Ebola, where was it coming from, what was causing it, and we did better with SARS and MERS, but it still took significant time. We have never, in the history of science, ever understood more about a virus and its interaction with human beings in such a short time, and developed so many ways to counter the virus, and so many mechanisms and methods, and now therapeutics and potentially vaccines and diagnostics and all of that. So we have to celebrate that as something we've learned. But I think we've also learned that science doesn't work without community. And you can have all the technology and all of the solutions that you like, and I think it's the same with all technology. If people don't use it, and if people don't believe in it, and if people don't put it to good use, then it doesn't do anything. Technology and knowledge by itself has no inherent value unless it is put to use. And that is what we've all struggled to do. We've all struggled. Governments have struggled to put that knowledge to the best use. Communities have struggled to fully understand and internalize what that means for them and their individual and community behavior. So I think that's where we're learning too, that just the conversion of knowledge and science into effective action is not a straight line. And we need to respect that and need to understand better how better to communicate with people on what protects and what protects their health. But in more general, what have I learned? And I suppose these are the principles that guide any endeavour in human society, be it as we face climate change, or we face social injustice, or we face racism, or we face that our planet as we face. What are the things that I've learned in this event that are applicable to other things for us as a society, as a community? Unity, empathy, solidarity.
And continue to work with different groups. You've heard us talk a lot about youth groups, because so many different groups can play a role in this. But I do hope that everybody feels a sense of